Top 25 EMS Interview Questions and Answers. If you're preparing for an EMS interview, you're in the right place. Today, we're breaking down the top 25 EMS interview questions and answers that help you stand out, feel confident, and shine like a true professional. Whether you're a fresh graduate or transitioning from another field, these responses will guide you through teamwork, patient care, decision-making, and emergency scenarios. So grab a notebook, because this is your EMS interview masterclass. 1. Tell us about yourself. I'm a motivated and dedicated individual with a strong passion for emergency medical services and patient care. I completed my EMS training with a focus on hands-on experience, teamwork, and strong communication skills. I enjoy working in fast-paced environments and pride myself on staying calm under pressure. I chose EMS because I want to make a positive difference in critical situations and help people during their most vulnerable moments. Outside of work, I stay physically active and continuously improve my medical knowledge. I believe my compassion, discipline, and work ethic make me a strong fit for this EMS position. 2. Why do you want to work in EMS? I want to work in EMS because it combines my passion for helping others with my ability to stay calm in high-stress situations. I've always felt drawn toward roles where quick decision-making and compassion matter. In EMS, every day brings a new challenge and a new opportunity to save a life or bring comfort to someone in crisis. I find meaning and purpose in being the first point of support for people in emergencies. EMS also offers continuous learning, strong teamwork, and real impact in the community, which makes it the perfect career for me. 3. What makes you a strong candidate for this EMS role? I bring a combination of technical knowledge, emotional resilience, and strong communication skills. I stay calm under pressure, think quickly, and follow protocols accurately. My training and hands-on experience have strengthened my ability to assess patients, provide compassionate care, and coordinate effectively with team members. I'm committed to patient safety, continuous learning, and maintaining professionalism in every situation. I'm also physically fit, reliable, and always on time. Beyond skills, I genuinely care about the well-being of others and take pride in being someone people can trust during emergencies. These qualities make me a strong candidate for this role. 4. How do you handle stressful or high-pressure situations? I manage stress by staying focused on the task, keeping my breathing steady, and relying on my training. In high-pressure situations, I prioritize the most critical needs first and follow established protocols to ensure safety. I also communicate clearly with my team to avoid confusion and maintain control of the scene. After the call, I take time to decompress and reflect on the situation so I can learn from it. I believe maintaining a calm mindset allows me to make better decisions, deliver effective care, and support both patients and team members during challenging emergencies. 5. Describe a time you stayed calm in an emergency. During my training, I responded to a patient experiencing severe breathing difficulty. The scene was chaotic, with family members panicking. I focused on maintaining calm, performed a quick assessment, and immediately administered oxygen while assisting with proper positioning. I communicated clearly with my partner and reassured the family while gathering essential information. By staying composed, we stabilized the patient before transport. The experience taught me the importance of professionalism, teamwork, and staying emotionally grounded. It strengthened my confidence in handling intense situations while ensuring the patient received timely and effective care. 6. How do you prioritize patient care during an emergency? I follow the principle of treating the most life-threatening issues first. My first step is always scene safety, followed by a quick primary assessment to identify airway, breathing, or circulation problems. Once immediate threats are managed, I perform a secondary assessment to gather more details. Communication with my partner is crucial, so we divide tasks efficiently. I also consider factors such as patient age, medical history, and mechanism of injury. Prioritizing care ensures that each patient receives appropriate attention at the right time, improving outcomes and keeping the scene organized and safe. 7. What does professionalism mean to you in EMS? Professionalism in EMS means maintaining a high standard of behavior, attitude, and performance at all times. It involves respecting patients, protecting confidentiality, following protocols, and treating everyone with compassion regardless of their background or situation. It also means being punctual, reliable, and committed to learning. Professionalism extends to communication, speaking calmly, listening actively, and working cooperatively with colleagues. Even in emotionally challenging cases, professionalism means staying composed and making decisions in the patient's best interest. Ultimately, being a professional in EMS means representing the organization with integrity and ensuring patient care always comes first. 8. How would you handle a difficult or aggressive patient? I would first ensure the safety of myself, my partner, and the patient. I'd use a calm and non-threatening tone, showing empathy while trying to understand the cause of their behavior. Sometimes fear, pain, or confusion can make patients react aggressively. I avoid escalating the situation and give them space when possible. If necessary, I would request law enforcement support. Throughout the incident, I remain professional, follow protocols, and document everything accurately. My goal is always to protect everyone involved while still providing the best care possible. 9. What would you do if your partner and you disagreed on a treatment plan? I believe communication and teamwork are essential. If a disagreement arises, I would calmly discuss our perspectives while referencing protocols and patient condition. My goal would be to find a solution quickly without delaying care. If we cannot agree, I would follow the chain of command or rely on the more experienced provider's judgment, depending on the situation. Once the call is complete, we can review the case together to understand what happened and improve future teamwork. Ultimately, patient care and safety come first, so disagreements must never interfere with delivering appropriate treatment. 10. How do you ensure patient confidentiality? Confidentiality is essential in EMS. I make sure to discuss patient information only with those directly involved in the patient's care. I avoid sharing details in public areas or on social media. I document information accurately and store reports according to guidelines. Even when speaking with family members, I share only what is necessary and appropriate. Respecting confidentiality builds trust, protects patient rights, and follows legal requirements such as HIPAA. As an EMS provider, I treat every patient's information with the same level of care and professionalism I'd expect for my own family. 11. How do you stay physically and mentally prepared for EMS work? I maintain my physical health through regular exercise, proper hydration, and adequate rest. Strong physical fitness helps me handle lifting, carrying, and long shifts. Mentally, I stay prepared by practicing stress management techniques, reviewing protocols, and continuously learning. I also reflect on challenging calls to improve my performance. When needed, I talk to trusted colleagues or mentors for support. Staying balanced helps me avoid burnout and gives me the clarity needed to respond effectively to emergencies. I view physical and mental wellness as essential tools for providing safe and reliable patient care. 12. Describe your understanding of EMS protocols. EMS protocols are structured guidelines designed to ensure safe, consistent, and effective patient care. They outline assessment steps, treatment procedures, medication dosages, and transport decisions. Protocols serve as a foundation for making sound clinical choices, especially during high-pressure situations. They also ensure legal protection by standardizing care across providers and agencies. I understand that while protocols must be followed, critical thinking is also important when applying them to unique situations. I regularly review and stay updated on protocol changes to ensure my practice remains accurate, efficient, and compliant with current medical standards. 13. How do you handle emotionally challenging calls? Emotionally difficult calls are part of EMS, but I focus on staying present and providing the best care possible in the moment. After the call, I take time to process what happened, whether through reflection, talking with coworkers, or participating in debriefings. I remind myself that I did my best and followed protocols. If needed, I seek support from supervisors or mental health resources. Maintaining emotional resilience helps me stay effective on future calls. I believe balancing empathy with professionalism is essential for long-term success in this field. 14. What steps do you take to ensure scene safety? Scene safety always comes first. I assess the environment before approaching the patient to identify hazards such as traffic, fire, weapons, unstable structures, or aggressive individuals. I ensure appropriate protective gear is worn and request additional support if needed, such as fire or law enforcement. Throughout the call, I remain aware of my surroundings and stay in constant communication with my partner. If conditions change, I adjust our approach or retreat if necessary. Ensuring scene safety protects both responders and patients and sets the foundation for safe and effective care. 15. How do you handle family members during emergencies? Family members often feel scared, confused, or overwhelmed during emergencies. I communicate clearly and calmly, explaining what we are doing and why. I reassure them that we are working to help their loved one and ask for important information if needed. When possible, I give them simple tasks to keep them engaged and reduce panic. If a family member becomes disruptive, I maintain professionalism while keeping attention on the patient. My goal is to balance empathy with efficiency, ensuring that family members feel heard while allowing us to provide timely and effective care. 16. Describe how you handle multiple patients in a mass casualty incident. In a mass casualty incident, I follow triage protocols to quickly categorize patients based on severity. I focus first on those with life-threatening conditions who can still be saved. Clear communication with the incident commander and other responders ensures coordination and resource management. I avoid becoming overwhelmed by staying systematic and following established procedures. My goal is to do the greatest good for the greatest number of people. After initial triage, I assist with treatment, transport decisions, and documentation. Staying organized and calm is essential for managing multiple patients effectively during a major emergency. 17. What does teamwork mean to you in EMS? Teamwork in EMS means trusting your partner, communicating openly, and working together toward a shared goal, providing safe and effective patient care. Every team member plays a crucial role, whether it's assessing the patient, gathering equipment, driving, or communicating with dispatch. I value feedback, share responsibilities, and support my partner both in routine calls and high-stress situations. Strong teamwork leads to smoother operations, better decision-making, and improved outcomes for patients. It also builds a positive work environment where everyone feels respected and supported. For me, teamwork is the backbone of successful EMS work. 18. How do you manage time effectively on emergency calls? Time management begins with rapid scene assessment and clear prioritization. I focus on addressing life-threatening issues first, followed by essential care steps. Communicating efficiently with my partner helps avoid unnecessary delays. I also prepare equipment in advance, follow protocols, and make decisions quickly but thoughtfully. During transport, I use time wisely to reassess the patient, gather information, and prepare documentation. Effective time management ensures timely treatment and reduces risk for the patient. By staying organized and decisive, I'm able to deliver high-quality care even in fast-moving, unpredictable situations. 19. How do you stay updated with EMS knowledge and skills? I stay current by attending continuing education courses, participating in workshops, and reviewing updated protocols. I also read EMS journals, watch training videos, and learn from experienced colleagues. Regular practice, including simulations and hands-on drills, helps me strengthen practical skills. When I encounter unfamiliar situations on calls, I study them afterward to improve my knowledge. Staying updated ensures I provide safe, evidence-based care and stay confident in emergencies. EMS is always evolving, so I make ongoing learning a priority throughout my career. 20. Tell us about a time you worked well under pressure. During a multi-vehicle accident scenario in training, several patients needed immediate assessment. The scene was chaotic, but I stayed focused on triage and followed protocols. I communicated constantly with my partner and other responders while providing care to a patient with serious injuries. Despite loud distractions and time pressure, I kept calm and prioritized efficiently. The situation taught me the importance of composure, teamwork, and critical thinking. By staying structured and confident, we stabilized the patients and ensured smooth transport. The experience strengthened my ability to stay effective under pressure. 21. How would you handle a situation where equipment malfunctions? If equipment malfunctions, my first priority is patient safety. I would immediately switch to backup equipment or use alternative methods based on protocols. I stay calm and communicate with my partner to avoid delays in patient care. After the call, I thoroughly document the issue and notify the appropriate personnel so the equipment can be repaired or replaced. I also perform regular checks before each shift to reduce the risk of malfunctions. Being prepared, adaptable, and resourceful helps ensure patient care continues smoothly even when unexpected issues occur. 22. How do you communicate effectively with patients? I communicate with patients using a calm, clear, and respectful tone. I introduce myself, explain what I'm doing, and reassure them throughout the process. I ask open-ended questions and actively listen to understand their symptoms, concerns, and history. I avoid medical jargon and use simple explanations when discussing treatments. Building rapport helps reduce patient anxiety, improves cooperation, and ensures accurate assessments. Even when patients are scared, confused, or in pain, I remain patient and supportive. Effective communication is key to delivering quality EMS care. 23. What would you do if you witnessed unethical behavior from a coworker? I take ethical standards seriously. If I witnessed unethical behavior, I would remain professional and follow the proper reporting procedures. If it directly affects patient safety, I would intervene immediately to prevent harm. After ensuring safety, I would document the incident and report it to a supervisor according to organizational policy. My goal is to maintain integrity, protect patients, and ensure accountability within the team. Addressing unethical behavior is essential to maintaining trust, improving care quality, and upholding professional standards in EMS. 24. How do you handle mistakes you've made on the job? If I make a mistake, I take responsibility immediately. I assess whether the mistake impacts the patient and correct it as quickly as possible. I communicate honestly with my partner or supervisor and follow proper documentation procedures. After the situation is resolved, I reflect on what happened to understand how I can prevent it in the future. Mistakes can be valuable learning experiences when addressed properly. Being honest, accountable, and committed to improvement helps build trust and ensures patient safety remains the top priority. 25. Where do you see yourself in 5 years? In 5 years, I see myself growing as an experienced and confident EMS professional. I hope to take on more responsibilities, continue advanced training, and possibly pursue additional certifications such as paramedic or specialized rescue training. I want to contribute to my team, support new trainees, and be recognized for my reliability and strong work ethic. My goal is to keep improving while making a meaningful impact in my community. EMS is not just a job for me, it's a long-term career path where I plan to learn, grow, and serve others. Thanks for watching. I hope these top 25 EMS interview questions and 100-word answers help you feel confident and fully prepared for your upcoming interview. Remember, practice your responses, stay calm, and let your passion for patient care shine through. If you found this video helpful, make sure to like, subscribe, and drop a comment telling us which career field you want next. Good luck, you've got this.